Welcome to the Zoom webinar. If interpretation is available for your language, here's how to join your preferred channel. Once you've joined the webinar, look at the bottom of your Zoom window. You'll see a globe icon labeled Interpretation. Click the interpretation icon to open the list of available languages. Select the language you want to listen to. For example, click French to hear the webinar in French. You can also choose to mute the original audio so you hear only the interpreter. And that's it. You're now connected to the interpretation room and can enjoy the webinar in your own language.
Thank you. Thank you. Awesome. I'm hoping that was helpful. And if still not challenged, please utilize the chat box and our team will be able to reach out to you and support you. All right, as we get started, what's the aim of this webinar today? Why are we here today? What does this webinar aim to achieve? One is to reflect on strategies that have made progress, share insight on what's working, and discuss the current realities in Kenya, Ethiopia, and Somaliland. Number two is this webinar aims to spotlight how survivors, youth champions, community leaders, CSOs, and partners are working together collaboratively to achieve milestones, sustain momentum in the efforts to eliminate FGM. And thirdly, is that this webinar aims to call on all stakeholders, government, allies, to sustain the gains, allocate resources, and take bold steps towards elimination of FGM. And to be able to do this, we are joined by our speakers from Somaliland, Ethiopia, and Kenya, who will share with us their experiences, strategies of what is working and what is not. We are also on social media. Please follow us, like us, post a learning and comment from this webinar, and see our social media handles in the chat box that I think Viola has just posted or is in the process of posting. So yeah, this and that also include, I think, the YouTube where this will be posted so that we are all on the same page. So yeah, Viola will be posting that. Thank you, Viola, as you get ready. And in case I didn't introduce my name, or you did not get it, my name is Jacob Okumu, an advocacy officer from the Girl Generation, and I will be your co-moderator. Our main moderator today will be Caroline Maringa. I'm a Caro Maringa from Africa Capacity Alliance. So before I hand it over to Caro, and again in the spirit of celebrating the International Day of the Girl Child, I would like to welcome Mark to share with us a short video of spoken word, which is sort of a reflection in the celebration of this day. Over to you, Mark.
Hello, everyone. My name is Dahabo Guracha, mostly known as Golde Gracia. I am gender activist doing advocacy project through spoken word poetry. I come from the hills of Sololo in Kenya, and I am so happy to celebrate this year's the Day of Girl Child with this piece that I'm presenting to you today. I hope you enjoy. Thank you. Tell me, why is the girl child taught silence before speech? Why is her voice seen as an echo, an afterthought, a whisper in the wind? You speak of culture, but does culture cripple? Does tradition chain her brilliance, keep her light under lock and key? Tell me, why does she bear the brunt of broken systems, the weight of violence, of fear, of peace? Is this the legacy you give to her? Is this the future you carve for the girl who dreams, who holds the stars in her eyes and galaxy in her soul? You tell her, not yet, not you, not here. But what of her brilliance, her spark, her talent, her truth? Tell me, are these not the seeds of change? Are those not the flames waiting to burn bright in a world too often shrouded in darkness? You see, 10 years ago, the pain was a secret, locked away, hidden behind the closed doors in rural homes and faraway lands. But today the silence is cracking, the secret is leaking, the world is listening, the world is rising to say, enough, enough, enough. I've seen whispers turning to roars. I've seen hands once bound, now raised in defiance. I've seen the blade blunted, the scars no longer the silence. Survivors are not the victims. They are the warriors with stories that shake the earth. Give them the tools, give them the stage, for their voice holds the weight of change. So partners, listen close. The next decade is where we do the most, where we elevate, educate, and dedicate our time, our resources, and our hearts to create a world where girls are no longer defined by cuts, by scars, by traditions and kind. So let us focus on her, the girl, the woman, the survivor, the star, for she is the future and she will take us far. So let us declare it with rhythm, with fire, with force. They are the vision. They are the future. When we see a future without FGMC, we see a future where girls stand tall, untouched, unbroken, unbound, because she will rise again and again until every girl child knows her place is here, her time is now, and her power is unstoppable.
Thank you so much. Thank you so much.
Wow. Oh.
Brilliant. Over to you, Caroline. Please take us away.
Okay, thank you so much, Jacob. Thank you so much. That video was awesome. Let's show her some love, some appreciation, some emojis to just show some love to her. Indeed, awesome, 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 awesome. Looking forward to that world without FGMC, that world, that is what we desire to achieve. Indeed, we are on the video, on the network, on the long-awaited webinar. We've been talking about it, we've sung about it, we are ready for it, and we're happy to be online. Thank you so much, everyone who's been able to log in. We really do appreciate you taking your time to be on this webinar on this day, and we totally appreciate you. My name is Caroline Maringa, or Caro Maringa, as I prefer to be called. And I am here with my co-moderator, Jacob, and we'll be taking you on through this webinar. So I'm a program manager at the African Capacity Alliance, been doing training and capacity building and system strengthening for the longest time. And I'm very passionate about this matters pertaining FGMC. And I've been in this movement since its inception, even long before the launch. We started it off with Alice and a great team that just brought this on. This far we have come. And I'm glad to be on this, to be moderating you today. I've been a short term, like I mentioned earlier, to the team from Yank. I'm so excited to see the Youth Anti-FGM Network growing in leaps and bounds. When they were starting off, I did a short term project with the girl generation. It was called Turn Up the Volume Project. And that was being implemented in Kenya and Nigeria, which had an aim of strengthening the youth leadership for social change to end FGM. And thereafter, the youth network, the leadership just took off and grew. And I'm glad to see that they have come this far. And in addition to that, currently I sit in the executive committee of the Girls Not Bride Kenya. So I'm really, really excited to be moderating this webinar. And without much ado, I would like to welcome our first speaker. Our first speaker for the day is Alice Ngari. She is the movement building lead at the Girl Generation. And Alice is an accomplished and innovative program management, partnerships, gender and mental health specialist with over 15 years of multifaceted experience in humanitarian and development aid programs. Alice is also a seasoned movement builder, known for creating inclusive platforms that mobilize diverse actors around shared goals for gender, justice, and social transformation. Alice will share to us an overview of the movement to end FGM in the focal countries in which TGG ALM operates in. Alice, you have 2.5 to 3 minutes to just give us that brief overview. Over to you, Alice.
Thank you so much, Caroline. Please confirm that it can be heard.
Yes, loud and clear, Alice.
Thank you so much. I would like to start by saying that at the Girl Generation, we are the support. We're not the movement, we are the support to the movement. And I want to say that Our movement building approach in the 4 countries is rooted in community leadership, in survivor agency and youth-driven activism across the countries where we are working. And these countries include Kenya, Ethiopia, Somaliland, and Senegal. So we support national efforts to end FGM, and we use localized strategies, including capacity strengthening and storytelling that shifts social norms and drives change. So if I could just briefly share country highlights. In Kenya, there are significant studies in policy and coordination, and the establishment of the anti-FGM board, alongside strong survivor and youth advocacy networks, has created a robust environment for advocacy, and we really leverage on this. In Ethiopia, the environment in Ethiopia, they use a multi-sectoral approach through the National Alliance to End Child Marriage and FGM. And this alliance brings together government, CSOs, and UN agencies. And the alliance model enhances coordination, advocacy, and policy implementation. Senegal, on the other hand, is a country that is recognized for, community-led initiatives. They use alternative rites of passage, and they are doing well. And they also have a strong engagement of the religious and community leaders. In Somaliland, I would like to say that the context is complex and it is unique, and this is due to religious and cultural sensitivities around FGM in Somaliland. However, there has been a growing momentum through collaboration between government, CSOs, and traditional leaders. So I would like to say that as a program, ALM supports coordination and collaboration of civil society organizations and grassroots champions to amplify local voices and ensure national commitments translates into real change on the ground, because grassroots are very critical in movement building. So our program has heavily invested in efforts that uplift survivor voices, as I said, and also creating space for challenging deep-rooted norms. So we have been elevating local leadership and fostering collective action in the 4 countries that we work with. And I also want to say that we value the youth not just as participants, but as leaders in the movement to end FGM. And we really invest in the voices of the youth. So let me just conclude by saying that each of the countries that we work in, the 4 countries I mentioned, they have unique context. But I would also like to emphasize that our shared vision is bold and it is unified, and it is a world free from FGM, a world that is powered by people that are most affected. And that is the approach that we are using. Thank you so much, Caroline.
Thank you so much, Alice. Indeed, what we want to echo, all of us, a world free from FGM. If we take out nothing from here, let that keep ringing in our minds, that is what we are all standing for and all working towards, a world free from FGM. Thank you very much, Alice. So we move on swiftly to our second speaker. Our second speaker is Hodan Abdisalan from Somaliland. Hodan is a dedicated advocate for women's empowerment and the elimination of gender-based violence. She's the head of the GBV FGM section at the Ministry of Labor, Social Affairs and Family. And Hodan will be responding to this. The context in Somaliland is different due to the complex nature of FGM. Could you share with us the strides made in the past, in the recent past? And you have about 3 minutes to respond to that. And I'd kindly request all our guests, should you have any questions, any comments, please put them on the chat box. Thank you very much. And over to you, Hodan.
Thank you, Carolina. Let's start. So I can use 1 minute from my time allocate for me. Should you want to answer only one question or the 3 questions?
No, you're answering. Could you share with us the strides? We are talking about the strides,
okay, the
that have been made in the recent past. Yes, please.
Thank you. I'll understand. The effort is that Somaliland or the Ministry of Labor, Social Affairs and Family, specifically the effort is that they do for the past years. I can mention 4 comprehensive things from that effort, which is that the National Anti-FGM policy was approved in 2024, as well as a fatwa legal opinion permitting one form of FGM was issued by religious leaders in 2017. And the third thing was that grassroots community structures have been established, and including women, anti-FGM, and champions, university girls clubs, and FGM task force from Parliament and from the Ministry, as well as legal technicalities or the legal advisors, as well as the National Anti-FGM Steering Committee in place to coordinate national efforts and to transfer it into action, or to combine it and transfer the efforts that made by the Parliament, the Ministry, and the other routes of Somaliland into action. That's all I can share. Thank you so much.
Oh, thank you. Thank you. You have actually used less than the 3 minutes. We appreciate it. I'm sure we're going to get to learn more about that as we proceed on. Thank you very much, Horden.
Thank you.
All right. Our third speaker, our next speaker is Mallet Amare Deresi from Ethiopia. Mallet, I hope you can hear me. Mallet?
No.
Mallet, can you hear me? Jacob, could you kindly confirm to me if Mallet is online?
Okay, great. Yes, she is online.
Yes.
Just not sure if we could, yeah.
Okay.
Perhaps we can go to Madam Loloju as Mallet is sorting this out, yeah.
Okay, that's fine. All right. As Mallet is being sorted out, we all know that technology can sometimes be technology. I'd like to invite our fourth speaker from Kenya, Mrs. Benedette Loloju. And like I had mentioned, she was looking very pretty. Mrs. Benedette is the Chief Executive Officer of the Anti-FGM Board in Kenya. She's a passionate rights crusader. She is committed to ending the practice of FGM in Kenya and envisions a world free from FGM by 2030. She has over 15 years of experience in girls and women's empowerment. Madam Loloju, kindly let us know what strategies has the Anti-FGM Board of Kenya employed in reaching the milestones that you have today? And could you mention some of the key milestones Kenya has achieved in ending FGM? Over to you, Madam Loloju.
Yeah, good afternoon, everyone, ladies and gentlemen. Thank you so much. Can you hear me?
Yes, loud and clear, madam.
I'm deep down in the field in a place called Ngutoto. We are here today to start the celebrations of the International Day of the Girl. I'm telling you here, I think FGM is 98%, child marriage, teenage pregnancies. The situation is not looking very well. The indicators are not very good. And it's very sad because we still have a lot of work to do to really make sure that we have our girls saved from FGM and child marriage and making sure that they get access to school. But there is hope because we are here. At least we have a number of stakeholders who are here with us, the county government of Narok. So we are hoping that
ገዥም አሉ አብረውን ወደፊት እነዚህን ውይይቶች ከማህበረሰብ
but to see how we can have as many girls as possible. If you look at the statistics here, I think we only have maybe one girl with a degree or a diploma. So without education, we cannot have anything much that we can look up to. I'll be taking you through what Kenya has done. I'm sorry, but Kenya, I might be having a long speech. It might not be very long, but at least a lot of work has gone into making sure that we eliminate FGM. And so you'll allow me to switch off my video and then go into my presentation. Thank you.
Yes, please, madam.
A minute.
Okay.
Thank you very much again. The Girl Generation, Africa Capacity Alliance, COVAL, Youth Anti-FGM Network Kenya, our colleagues from Somalia and Somaliland and Ethiopia, and all the stakeholders who have joined us this afternoon, distinguished guests, ladies and gentlemen. It's just another opportunity for us to meet and just reflect and share our actions in ending FGM. After all, it is said, actions speak louder than words. Many a times we meet and discuss about what we need to do, but rarely do we take our time and look at what we have done. Looking at what we have done is a moment of soul searching, a moment to ask of ourselves rhetorical questions regarding our interventions, a moment for accountability, measurement, and self-appraisal regarding the resources we put in our interventions. It is a moment of determining what is working and not working, a moment for cross-learning and knowledge transfer. It can also be a moment to savor our successes and unlearn our failures. Ladies and gentlemen, the Anti-FGM Board Kenya has always remained yours truly and a leading government agency in the campaign against FGM. Among the actions the board has adopted to eradicate FGM in Kenya include public education and awareness creation on the effects of FGM and existing legal framework. Under this, we have capacity building of resource persons and duty bearers. We have reaching out to Kenyans with anti-FGM messages through the media, print and electronic and social media, training and recognizing of anti-FGM champions, engaging religious leaders, enhancing the My Dear Daughter campaign as a clarion call to mothers to protect their daughters, development and dissemination of anti-FGM information, education, and communication materials, observing international days that advocate for the rights of women and girls, including International Day of Zero Tolerance for FGM, International Day of the Girl Child, International Women's Day, Day of the African Child, and International Widows Day. We've also done cross-border engagements to curb cross-border development, including cross-border declarations, development of the coastal regional cross-border action plan to end FGM. Another action that we have taken is strengthening coordination structures and partnerships. Number one, under that is establishment and operationalization of the county and sub-county anti-FGM steering committees. As we are aware, Kenya is divided into counties. Conducting stakeholder mapping in the FGM hotspot counties to improve on program implementation, coordination, and reporting. In Kenya, we have 22 counties that we consider counties with very high prevalence. We know that Kenya is at 14.8% for women between the age of 15 to 49. That is according to the Kenya Demographic Health Survey 2022. And we are at 9% for girls between the age of 15 to 19. Those statistics look good when you look at them from the national reporting. But what I want to say is that we have counties that have as high as 94%, 96% of FGM, 86% of FGM, 76% of FGM. And we have villages like where I am today, where we are at very high. When I look at this community, I think we are at 98%. And when we met last week, looking at issues of data, I'd say that we cannot continue doing programs without having good data that gives us exactly what is happening at village level, at community level, having data that can help us really know in this area we are red, in this area we are yellow, in this area we are orange, so that we are able to have targeted programming so that we can go to the most affected communities and really have a conversation with our communities. We also have, under that, we have established a multi-agency technical team from different ministries, departments, and agencies to oversee the implementation of anti-FGM interventions. In Kenya, as we are aware, or even all over the world, FGM is a health issue. It's an issue that leads girls to drop out of school, so it's an education issue. When we have the law in place also, it has to be implemented, and in Kenya, it's implemented by the Ministry of Interior and Coordination of National Government. We have the Office of the Director of Public Prosecution, we have the judiciary, and so in Kenya, we have a multi-sectoral kind of focus on ending FGM. And then we have our development partners, we have the community-based organizations, we have the youth networks, we have the men-led organizations, because men are also critical in the campaign. So all of us in Kenya are working towards zero, but we are not moving as fast as we want to now, 5 years to 2030. We also have issues of engaging with the healthcare workers because of medicalization of FGM. We know that medicalization of FGM is the elephant in the house. It is what is now going, and soon it will be even at 50-60%. And so we really have to see how we can continue engaging with healthcare workers to make sure that FGM is not medicalized, because that one will really give us a hard time to end FGM in our communities. We are also working with health promoters to mainstream anti-FGM campaign in their community health promotion. As we know, in Kenya, our president launched the community health promoters, where in every village we have CHPs who work to make sure that in each household our communities are taken care of in terms of health. And so this is an area that we are looking forward to really engaging the health promoters to see to it that they also become anti-FGM champions. Linking and networking with civil societies and partners, promoting community dialogue and movement building. We also facilitating dialogue forums with elders as custodians of culture, facilitating declarations by elders to end FGM and child marriage among communities, supporting the launch of the youth anti-FGM networks and engagement of colleges and university students, supporting and strengthening the capacity of community-led organizations in ending FGM, supporting civil society conferences to share successes, challenges, and best practices, supporting girls rescued from FGM, and supporting the establishment of survivor networks. I hope I still have time, or do I still have time?
For the next questions.
Okay.
Yes, thank you so much. Indeed, awesome. Wow, that is awesome work. Thank you so much, Madam Bernadette. Indeed, there's a lot that you're doing at the Anti-FGM Board, and we really totally do appreciate all the efforts that you're putting together. And and one thing that comes out clear, data. I think it's something that we should make sure that it's always at the back of our minds, even when we are doing all our programming work, because really we need evidence so that we can be able to have our interventions done in the right way and more holistically. So thank you so much for that broad, deep overview. And I'd like us to proceed on to the next speaker. A special request to our speakers, our presenters, if you could really try and slow down your speaking a bit more slowly. I know sometimes we get excited at what we do, and so we end up speaking faster. It poses a challenge to the sign language interpreters as they're trying to figure out what it is that we're saying. So, but yes, thank you so much. We're also really appreciative of the language interpreters. We know that it's not easy. So our next speaker, I'm not sure whether Marlet has come back online.
Yes,
she's
signaled that she's ready. Good.
She's ready. Okay, Marlet, welcome. Marlet Amare Deresi is from Ethiopia. Marlet is a gender and social affairs professional with over 9 years of experience in women's empowerment, policy development, and gender equality advocacy. She holds a BA in sociology from Hawassa University and an MA in social psychology from Addis Ababa University. Marlet is the National Alliance. She's in the National Alliance to End Early Child Marriage and FGM. This is an alliance in Ethiopia that comprises the government ministries of women and social affairs, health and justice, along with UN agencies, CSOs, and NGOs. So Marlet, what lessons can you share with us that show the benefits of the National Alliance to End Child Marriage and FGM? And please remember you have 3 minutes for this question. Thank you. Over to you, Marlet.
First, as a national alliance, we have seen 4 benefits. As you all know, the National Alliance was started to cascade works at a ministry level, at a UN agency level, and to also involve international and governmental organizations, civic societies, religious institutions, as well as community groups. And this is a platform involving all of these stakeholders I just mentioned. The objective to work on FGM together is to avoid duplication of efforts. Secondly, it also harmonizes the planning in order for all parties to plan together as stakeholders and to implement our works together. It avoids competing and helps us to complement and work together. Similarly, when partners bring all their works together, we have created a national roadmap in order to implement these 5 years FGM prevention work. So for the 5 years, we have come up with a plan to work together, to bring our resources together and come up with an impactful implementation. Moreover, evidence-based programming and joint learning can gain a lot of benefits from this alliance. The alliance brings together many evidences. It helps us generate evidences. It also allows us to host joint experience sharing platforms. That was also an opportunity we gained from the alliance. It also helped us to have a unified voice of partners to amplify our advocacy works, especially in key policy advocacy platforms and opportunities. It also helps us in social norm changing and gender-related works we undertake. Moreover, it also allowed the community to have ownership and to bring about multi-stakeholders into the work. Since we do this together, we say that there are multi-stakeholders involved for a unified and integrated action.
ግንዛቤን ለመፍጠር በማህበረሰቡ ውስጥ ቢሄቪራል ቼንጅ ኢንተርቬንሽኖችን ለማድረግ እንዲሁም ደግሞ ሜኪንግ
behavioral change and to make the prevention efforts to be culturally grounded and to be sustainable in the community. So that's the change we can confidently talk about. So, and this is what we have been working at our capacity. Thank you.
Thank you very much. Marlet, sorry. Thank you very much, Marlet. We totally do appreciate. And for those of us who've been online listening in, I hope you were able to do the translation, the interpretation. I think we had gone through how you're supposed to click on that around a little circle on your screen. Then you'll be able to listen to it in English because you're speaking in Amharic. But thank you very much, Malet. You were more clearer now. At least we were able to hear. And thank you for the interpreter. We totally do appreciate. We've been able to gather what they have been doing in Ethiopia. And without much ado, I'd like to invite our next speaker. Our next speaker is Kumar Kasim Yusuf, a fearless voice in the fight against FGM, child marriage, and gender-based violence in Kenya's northern and pastoralist communities. As the founder and CEO of the Northern Counties Community Empowerment Organization, Kamar leads bold community-driven campaigns to protect girls' rights, challenge harmful cultural norms, and empower survivors to reclaim their voices. She's also a member of the Survivors Network in Kenya. Kamar has, for any movement, been successful in agitating for social and gender justice and those who are most affected at the center. So, Kamar, I have two questions for you. Why is it critical for survivors to lead the movement to end FGM? And secondly, how are survivors delivering change in their communities and collaborating with other stakeholders? Over to you, Kamar. You have 3 minutes to just tell us what you have been doing. Thank you.
Thank you, Caroline. Survivors are very critical to lead the movement to end female genital mutilation. Number one, survivors are the heartbeat. As we know that survivors are the heartbeat of the movement because of their lived experience. They have a powerful voice that bring truth to advocacy effort. Survivors can influence change by sharing their stories, challenging harmful norms from within, and build trust in the community that might be resistant to external intervention. Survivors-led movement ensures that solutions are survivor-centered, focusing on healing, protection, and prevention rather than punishment. Also, survivors serve as role models and change agents, inspiring young generation and influence community elders and leaders. So I think I can say that is why survivors are very critical in terms of leading movement and FGMC. Can you?
Yes, please.
Second question, please.
Yes, the second question is, how are survivors? Thank you for responding to this one, to the first one, and just letting us know that indeed survivors are critical to lead the movement to end FGM, and without their voices, it's very, very hard to continue, just fighting for their rights and just standing up for what they should be protected against. So basically, the second question is that how are survivors delivering change in their communities and collaborating with other stakeholders? Just a little bit more about what they're doing. Yeah, okay. Thank you.
Okay. Survivors are doing quite a number of interventions. If I start with one, the first one they are doing is in terms of influencing policies. They play a key role in shaping anti-FGM policy by representing other survivors. If, for example, if I give you a very good example, we have one of us from Kuria, Migori County. She's called Boke. Boke represented us, represented the survivors' voice in the draft of East Africa FGM bill. And also several survivors took part of in the county and policy. And for example, we have Naro County, whereby survivors were the center of in terms of from when the policy was in zero draft until the policy was passed. So I think that is number one. They play a big role in terms of influencing policies. And number two, survivors are doing capacity building programs. They train dozens of girls and young women in leadership and self-care skills. They also facilitated emotional well-being sessions whereby survivors shared their stories, reducing the stigma and build solidarity among the other survivors. Also, community engagement programs, like they have organized dialogues whereby they brought together women, elders, and religious leaders, what do you call, youth, young people, to openly discuss the female genital mutilation and how we can be able to stop or end the FGMC in our areas. And also survivors, they took part of different activities like the International Day. They celebrated International Days, the 16 days of activism. The survivors are actually doing a lot of work in different counties. For example, there is Isielo Mumina Jirmo, who are from Women Rising, who is doing mothers and daughters sessions, whereby she's bringing the mothers and the daughters in one group, because these are survivors who never had such spaces. So, and then she's providing therapy sessions, heart-to-heart sessions. Yeah, so, and for instance, all this is happening, all these survivors, few of us are being supported by donors. Some of them are doing out of their hearts. So I think that is why it is very important for survivors to be, that is the reason why survivors are changing a lot in terms of ending FGMC.
Oh, thank you. Thank you.
Yeah.
Sorry, were you done? Sorry.
No.
I know we have another couple of questions for you. Yes, but
okay. Survivors
yes.
are also doing mentorship programs for other survivors. For example, we have Afia Africa from Narok, who are doing what do you call girls camp, whereby FGM cases happen during the holiday seasons. So the girls are cut during the holiday season. So instead of the girls to be cut during the holiday seasons, they bring the young girls in girls camps, whereby they take them through mentorship programs. So survivors also conduct smart family sessions, whereby they bring both genders, the both female and the male, and to openly discuss female genital mutilation and the side effects and all that. And I think that is from my end.
Wow, thank you very much. When I looked at you, your demeanor looks like a very cool, calm, and collected person. But you call yourself a fearless voice. But based on what you have told us, I think if we allowed you to say more, it would be real indeed fearless. Thank you. Thank you so much. Thank you very much for that. We appreciate you. So our next speaker is Kera Abdi. Kera, Youth Anti-FGM Network of Kenya. Kera comes from Mandera, Kenya, where FGM and child marriage have silenced too many dreams. She chose to raise her voice for change as the program coordinator of Senko and focal person for Young Chapter in Mandera. She brings together survivors, youth, and community leaders to turn pain into power and tradition into transformation. She wants to see Mandera rise to a place where girls grow up empowered, educated, and free to shape the future. Kera, youth are said to be the present and future leaders of social and gender justice movements globally. How has the Youth Anti-FGM Network in Kenya strategized itself to lead in ending FGM? And like I mentioned before, I'm so excited to see Young on this platform. Go ahead, Kera, over to you.
Thank you everyone for having me. I am really happy to join this discussion, and thank you very much for the question. And I'm very happy to hear from Carolina that she's part of the life journey of Young. And today I can proudly and comfortably tell you that Young has positioned itself as one of the Kenyans leading youth movements to end FGM. Our strength lies in how we organize, how we mobilize young people from, the grassroots level all the way to the national coordination. So our strategies normally focus on, empowering these young people as a change agents. That's what I can say, through, advocacy, innovations and strong partnership. So we train the youth champions and survivors, advocates, to engage with the communities, challenge these harmful, norms in our context, different contexts, and lead in the dialogue with, with the elders and religious leaders. So another strategies that young are using is they are using digital platform to tell the real stories, to raise awareness, and to unite youth voices across the country. As we all know that now we have 22 hotspot counties. So this online presence has created a sense of, belonging, a shared purpose among the advocates. So also young normally participate in the policy level, where we collaborate closely with the government and, partners to ensure that the perspective are part of the, anti-FGM strategies. So we are looking towards the global, goals of ending FGM by 2030. So in short, Young is a strategy is in youth-led, I can say. It is a communal drive and, partnership-based. So we believe in movements to end FGM must be, on by these young people themselves.
Wow, thank you. Short, precise, and to the point. That's the youth for you. Thank you very much, Young. We appreciate what you're doing. I guess in the next set of questions, we'll get to know a little bit more about the strategies you have and what you've been putting in place and where you are at so far. And once again, thank you very, very much for the good work that you're doing. I'm hoping that as we are continuing, our audience, you're putting your questions or comments in the chat box. We encourage you to do so that by the end of this webinar, we'll be able to look through the questions and we'll get our presenters responding to any of the questions that will be geared towards them. Without much ado, I would like to hand over to my core moderator, Jacob Okumu. Jacob, over to you.
Thank you so much, Carol. And thank you everyone for those insights. I'm looking through the chats and I'm just seeing people who are happy to be here. There's also a lot of congratulatory messages to the speakers, appreciation to Madam CEO. So many of the attendants are just happy to be here. Patrick is saying that happy to be in this forum and thank you for the great engagement. Do you have, so this is, I think is a question that Patrick is asked, do you have a research grant that can enable us to gather data, divisional, sub-county level, because we have realized that county data does not give the true picture. We are in narrow county where the official rate is 42% and we have division up to 99%, mission with a vision organization. Yeah, so I mean, I'm hoping that one of the panelists will pick that up. This appreciation to Madam CEO. We are proud of you for the work that you do. Yeah, great. So keep bringing them in, keep sending in your thoughts. And just to respond to Caroline's thought, there are already 4 questions on the Q&A section. So please bring up more questions to the panelists so that we can have them respond to those during the Q&A session. So we're going to take a little bit break just to allow, we're going to breathe in a little bit to allow all this knowledge and insights to sink in. as we plan ourselves to move into the next session. And as we do that, I would like to invite Mark again back into the commemoration of International Day of the Girl Child to share with us a small video of a poet. We are in love with poets. They communicate better. So it's a small video of a poet by one of the girls that we work with on the power of language. Mark, over to you.
The tool we use to build bridges or tear them down. It's the weapon we wield to heal or to hurt. Language is more than just the words we speak. It's the force that shapes the strong and the weak. It can heal the wound or make the pain real. I tell you for sure. In the fight to end FGM, we must choose the words that heal, the words that refuse, the words that twist the truth, disgust the arm. When we soften the language, we disarm. We call it a custom. Oh, we let it slide. We turn a blind eye and the truth hides. I ritually say, although it's just a game, but every word we choose, every word we use keeps FGM the same. We mask the cruelty. We mask the pain as though there's something we gain. And wouldn't you call a spade and not a big spoon? Or is it that this horror should still remain? So we need to shift the language, change the narrative, call it what it is, a crime, a violation, a mutilation. It's not tradition. It's not custom. It's a brutal assault on the body and spirit. Call it a sexual violence, a chain that binds women and girls to the past and keeps them from moving forward. And so I call for honor unto we, the survivors. For we ain't broken. For this is a war on the body, a war on spirits, a war on dignity. It is a war on freedom. I hereby urge all the donors, supporters, allies, and members of the anti-FGM movement, when you continue telling them that FGM is bad, please remind them that we are not bad. For from the shadow of violence we emerge with light in our eyes and fire in our heart, reclaiming our word with all the breath. We carry the weight of the past, yet our steps are light. Walking through the paths of greatness, turning every scar into a spark of brilliance, forging futures beyond the pain. In the face of adversity, we find opportunity, building careers and lives that echo with triumph. We are the truth definition of FGM doesn't really win. We are that proof that FGM doesn't win, aren't we? And if all of you want us to keep on winning, then we need to unpack all that is driving inequality, exploitation, and violence. And do you know how that one starts? It starts with each one of us as an individual and with us as teams and organizations. For together, we can. Let's not forget our language. Language is neutral. It's not neutral. It can either heal or hurt. At Soipan, the poet. Thank you.
Some love for Soipan. Awesome. Thank you. Also, just to highlight is that this powerful poem was recited first time at the Africa Committee of Experts on the Rights and Welfare of Children session in Maseru, which is an organ of the Africa Union. So you can see how far she has used poem to take the conversation and challenge stakeholders on the usage of language and the power of language in advocating on ending FGM. Right to the follow-up question or the second set of questions, and we'll start with Alice Ngare, our movement building lead. So over to you, Alice. TGGLM has been keen to bring together CSOs engaging in ending FGM to leverage on resources and networking. Can you share with us the journey towards the formation of the Kenya CSO network on ending FGM? Over to you.
Yeah. Thank you. Thank you so much, Jacob. I'm audible?
Yes, you are. Yes.
Okay, thank you. I would like to start by saying that just like you had Marlet point to the fact that the alliance in Ethiopia brings together or harmonizes different stakeholders, and that in this space they're able to learn and also they're able to share the challenges. This is the same idea that led to formation of the CSOs network in Kenya. And it emerged from a clear gap that was noted to exist here, that although CSOs have been doing a very good job in fighting FGM, they have been working in silos, sometimes, if not in most cases, duplicating efforts, and also lacking the strength in a unified voice. And so as a program, we realized this and the need to create a platform where collaboration, coordination, and collective advocacy by the CSOs can take place. And I would also like to mention that, of course, we took time to learn from some of the existing networks that have succeeded, like the youth network that is represented by Kira here, and also from the alliance in Ethiopia, because we had some engagement with them. And so the journey started by mapping the active CSOs in Kenya that are ending FGM. And we did this in collaboration with the anti-FGM board. And I have to point out here that they were very, very supportive. And all along, they have been very supportive in the establishment and strengthening of this network. And so we had dialogues with different organizations, and we came together to, craft a vision and a structure for the network. And through consultation, we supported the formation of a locally owned governance as a program, TGGLM. And how we did this is just creating an environment where the CSOs can come together, be able to deliberate on how they want the network to look like. And we also supported conventions where they would be able to have more deliberations. And in one of the conventions, we were able to have the CSO network members electing through a democratic process a national convener who is COVAO, and COVAO is represented in this webinar, so they are going to speak more into what the network is doing. And so we have continued supporting this network, and the network has been able to put up some structures, let me say some infrastructure within the network, so that we now have key thematic areas that the network wants to focus on. And they have also established a coordination mechanism in the 19 counties. I had Madam CEO already mentioning about the 22 hotspot counties. But in this network, we have been able to have representation for 19 counties in terms of coordination structures. So we have 19 focal persons who are representing 19 of the 22 hotspot counties. And of course, these structures have been formed, but they need operationalization, and they also need to continue being strengthened. As a program, we have been providing technical assistance, and we have facilitated access to strategic partners. We have also supported the network linkages with key government actors. Of course, the anti-FGM board is in the center of the whole of this process, and whenever we need any other partners, they are able to very quickly bring in the other partners that we need. And I also want to mention that recently we supported the network to develop and launch a strategic plan, the first ever for the CSOs-led network. And this is aimed at fostering sustainability of the network. And I would also want to say that today the network brings together over 80 organizations that have registered that are operating in different counties, and they are all operating with one common goal. That is to end FGM in Kenya. So I want to close this by saying that the network has become a space for CSOs, peer learning, and joint advocacy. We've been able to do quite some things together, and also, a space for sharing and mobilizing resources. This network also ensures that the national efforts remain grounded in community realities, which is very important. And I believe that this is a model that can be replicated and scaled in other counties. Let me also add that the network's journey is ongoing. It's not stopped, it's ongoing. And I would also want to say here that it's very promising. And I'm saying this with confidence because there are members of the network here, a lot of them, including our moderator, Carol. And I would also want to say that the momentum is strong. The voices are leading with charge, and they are very powerful. And this is all because COVAO, the now national convener, has deep community engagement and advocacy. And I want to believe this is the reason why they were chosen as the convener. And for us as a program, handing over the coordination of the network to COVAO was really a demonstration of the core values of the Africa-led movement, how it should look like. And we have centered local ownership. We have also ensured that survivors must be at the center of every process, as you heard Kamar saying. And we believe that we have also put power exactly where it belongs. And this is in the hands of those who are very close to the communities that we serve. And that is exactly who COVAO is. So we are very, very excited about this network. We have a very good vision for it, and we look forward to seeing. I know that as long as it is being coordinated by COVAO or any other locally led organization, it's going to go far because it is locally owned, people are shaping their vision, and communities are engaged. So thank you so much, Carol. I would like to end it there.
Thank you, Alice. Thank you so much. You've done very well introduction of COVAO. Now that they're next speakers, and maybe I should just mention that they were not. They were elected. It was a very intense election. As you know, for those of us who have interacted in elections in Africa, it was a very intense moment. But the majority of the members in the room decided democratically that owing to the expertise and the experience COVAO was bringing into the room, they would lead them. They were confident that they would lead them into the next phase. So over to you, Frida, as the leader of COVAO, as the convener of the CSO network to end FGM in Kenya. What is the vision from your standpoint of the CSO network in Kenya to end FGM and its alliances with other networks? And also couple that with who do you see as the key players in this network if it has to be successful? Over to you.
Thank you very much, Jacob. I hope you can all hear me.
Yes.
You can? Okay. Let me start by appreciating the immense technical and financial support that the TGG ADM program and the Anti-FGM board offered and continue to offer to the Kenya CSO network. It has gone a long way in bringing the network this far. To a point now, we have a strategic plan for the next 4 years. So the strategic plan for the CSO network on ending FGM was launched in July 2025, and the development of the strategic plan was a collaborative and consultative process. So it runs for 4 years, 2025 to 2029, and our vision is very clear. We are working towards a Kenya free from all forms of FGM, and where girls and women thrive in safe spaces. Currently, the prevalence of FGM in Kenya is at 15% as per the last Kenya Demographic Health Survey that was done in 2022 but some communities are as high as 80%, like other speakers mentioned. And what we are doing every day to get closer to this vision is now coordinating and amplifying the voices of all actors within the network who are working on this issue through research, advocacy, and survivor-led and community-driven solutions. So in the next 4 years, we are working around 6 strategic areas. I won't mention all of them, but if I can mention a few in the interest of time, it is one on community engagement, norms change, and social mobilization. We also have a strategic area on policy advocacy, legal enforcement, and accountability, and another one on evidence generation, research, documentation, and learning. A few things that we are keen on in the next 4 years is that we are intentionally partnering with non-traditional allies who have often been left out in the conversation in aiding FGM, such as religious leaders and cultural leaders, empowering them to drive change from within their communities. And we can attest that when a religious or cultural leader denounces FGM, they effectively link the practice from religion or tradition. And then we are also scaling up proven community-led approaches that are working in terms of bringing communities closer to ending FGM, like the holding of intergenerational dialogues. And we are also keen to learn on other strategies and their effectiveness, such as the public declarations and the alternative rite of passage. And then we are also very keen to work with survivors, not just as program participants or participants of the network, but as co-creators, so that we can co-create with them programs that brings communities closer to ending FGM. And then the network is actively working to influence policy at county and national levels, advocating for FGM priorities to be integrated into county development plans, such as the annual development plan. This will ensure that the government is able to plan and allocate resources towards ending FGM. And then we are committed to continuous learning and improvement through holding regular learning forums. We normally have monthly coordination meetings where in each meeting we have a key topic of discussion, and mostly is to ensure that we are sharing best practices and what is working on ending FGM. Now, to implement this strategic plan, we will need to implement this strategic plan, we will need 2.5 million USD. Our strategy, I can confirm this, our strategy is ready and the network is mobilized and intact, and our vision is clear. A Kenya free from all forms of FGM, where every girl and woman can thrive. Will you join us in making this vision a reality? I hope you can still hear me.
Yes.
Loud and clear.
Thank you. Thank you so much.
Can I go to the next question?
Yes.
Okay, on to the final question, which is on the stakeholders, whom we see as if is a key stakeholder in this network. So I must start by saying that ending FGM requires a coordinated effort that addresses the issue from multiple angles. That is legal, social, cultural, health, education. And with this, we are using a multi-stakeholder approach in our work. Madam Loroji has already mentioned the key actors, but just to mention is that anti-FGM board is a very key actor in our work, as well as other agencies and ministries, such as the State Department of Gender and Affirmative Action, state actors in the GBV referral pathway, such as the National Police Service, the Ministry of Health, judiciary, the Department of Children Services, because they are very key in coordination and especially in provision of timely services to survivors of FGM. And then I had already mentioned some, including survivors of FGM, because their voices and experiences are essential for effective advocacy, policy development, and policy development, as well as academic and research institutions, because we all agree here that we need data so that the data can inform programming. I'll end by saying that at FGM, we must engage every member of the society, from the lawmaker, the health worker, to the elder and the survivor. It takes a whole community united in one voice and action to create a culture where the practice simply cannot survive. Thank you.
Thank you so much. Thank you. Please, there's an emoji for clapping there. There's an emoji for hearts. Let's share this with Madam Frida. And so thank you for the amazing work that you do. There are many questions coming on the chat, and I'm hoping that we are taking notes. Caroline Maringa, who is our moderator, is also taking notes and will be leading us through a Q&A. And some of these questions revolve around how do people join network? How do you know you're a member of the network? And of course, there's congratulatory messages there. And you've mentioned Survivor Network as a key stakeholder. And we have Kamar. Kamar, please, the survivors in Kenya have established a Survivor Network. What is the vision of this network, and how can other survivors be part of the network? Kamar, over to you.
Thank you so much. Thank you so much, Jacob. The network was formed by 22 young survivors across 22 hotspot counties after they went through the survivors leadership training supported by the TGG ALM. This came about of majority of survivors felt that there was a need for them to cascade the knowledge they learned from the survivors leadership training to the community. That's why we have formed the network. After coming up with that, we did a concept to TGG, and TGG has accepted our concept. And then we did a thorough election, whereby out of 22 young survivors across 22 hotspot counties, 8 young survivors were elected. Actually, there was an election. They were elected. That is Mumina, who is the chairperson of the network from Isiolo County. And then we have our Able Rumana from Mandera County, who is the coordinator of the network. We have Halima, who is the treasurer of the network. We have Sandy from Elgeyo Marakwet, who is the vice chair of the network. And then we have Amina from Tana River County, who is in charge of programs. And then we have me, who is in charge of communication. And then we have Catherine Kate in Afia Africa, who is the host convener of the network. And then we have Soipano, who is from Laikipia, who is the welfare. You know, we cannot talk about wellness of the survivors without not having a welfare person. So basically, that is how, as we speak, the network looks like. And if you want to join the network, actually, before I go to how you can join the network, our vision for the network is a world where a survivor is empowered to heal and reclaim their identity. And for those who want to join the network, you can join the network in 3 ways. For one, we have chapters, county chapters. So far, we have launched 3 chapters, county chapters. That is a Laikipia chapter, Marsabit chapter, and Isiolo chapter. And for those who are coming from that county, they can join the network through those chapters. And we are planning to do a concept and fundraise for us to launch more chapters across the 22 hotspot counties. And then we have 22 focal persons in 22 hotspot counties. and who went through the survivors leadership training. They are our focal persons, and they're in each county, those 22 counties. You can talk to them, and then you can join the network through them. And then we have an online. The third one is we have an online registration form, whereby you can fill the form and then you join the network. So there's no fee, there's nothing, and the network is open to every survivor, whether you went through the survivor leadership training or not. It's open for everybody. I can share the link for those who want to join. So I think from my end is that.
Thank you so much. Thank you, Kamar. Please do share the link on the chat so that those who'd like to join can also join. Still on the network, Youth Anti-FGM Kenya is an exemplary network. Kera, would you please share with us how it is organized from the grassroots to the global level?
Thank you, Jacob, for the question. Thank you once again. The Youth Anti-FGM Network Kenya is structured in a way that it ensures young people at every level have a voice and a role to play in ending the FGM. For example, we have youth at grassroots level, where we have county-based focal persons. So these young leaders who coordinate activities within their local area, the context they live in. I'm proudly serving as a Mandera County focal person, where I support school outreaches, community dialogues, mentorship programs, and all these activities that directly engage with girls, boys, parents also, and local leaders. So these efforts normally help us to build trust within our community. It also helps us to shift the norms of the communities and empower youth to take the lead to in protecting girls. So we also have at the national level all the county focal person. We normally fit into the young national coordination teams. These teams now provides the technical guidance, and they mobilize partners, and they ensure that the local voices is the one that shape the national priorities and the national campaigns. So also beyond Kenya, Yank is also connected to the global youth network to end FGM. This linkage allow us to share lessons, participate in the international advocacy spaces. And it also ensures that the reality of the grassroots level that we normally conducted in the communities like Manderas are well represented globally. So our organization, I can say, is a truly bottom up from the village level to the global stage. So every young person is involved in both leaders and a change agents. So making these, we normally make these movements a dynamic, an inclusive, and a sustainable way. So in nutshell, I can say that we have seen this incredible, progress. We know that there's still a lot to be done, especially in a region like Mandera, Garissa, all these across the northern Kenya, where the prevalence of FGM remains high. So as a youth advocate, from Mandera, I have seen the first, hand the difference that even small investment in the grassroots initiative can make. So I therefore call all our partners, our donors, and the governments, to continue investing in youth-led and, community or also driven, the community-led efforts. So because real change, we all know that happen when the resource reach those who are closest to the problem. So all I can say, together we can keep the momentum strong and ensure every girl grows up free from FGM. So that's my take on that.
Thank you. Again, I see questions. Great work. There's many comments towards the speakers. Please receive your flowers. How have you strengthened the effectiveness and sustainability of the National Alliance to End Child Marriage and FGM?
Okay. Yeah. Can you translate it for me?
Yes, so what would happen? Yes, we have a translation.
Yes, I can.
So for the members,
Okay, I
the
think
audience,
he can hear me.
just go to the
ያጠናከርነው
global.
The way we strengthened
Go
it,
to the interpretation and
ኦኬ
click
የመጀመሪያው
here.
ያው ተቋማችን
we first, our institution
የመንግስት ተቋም ነው።
is a government institution.
ማንዴት አለው ማለት ነው።
It has its own mandate,
በተለይ ፕሮክላሜሽን
especially
1263 ህዝባር
Proclamation 1263/2021.
ሬስፖንሲቢሊቲው በተለይ
Responsibility,
ኮኦርዲኔት
especially
የማድረግ
the coordination task,
እንዲሁም ደግሞ የመምራት
and
አሊያንሱን
the
የሴቶችና
leading
ማህበራዊ
alliance
ጉዳይ
is
ሚኒስቴር ነው።
given to the Women and Social Affairs Ministry.
ያንን ስልጣን በመጠቀም ያው
By using
ሰስተናቢሊቲውን ለማረጋገጥ
this mandate in order to ensure its sustainability,
ያንን ስራ ሰርተናል ማለት ነው። ከዛ ውጪ
we have undertaken this responsibility.
ሶስት ኮሚቴዎችን አዋቅረናል።
Also, we
የመጀመሪያው
have set up
ጀነራል
3
አሴምብሊ
committees. We have the General Assembly, one, we also have the technical committee, as well as the steering committees.
ስለሆነም እነዚህ አካላት
Therefore,
ክሊር የሆነ ሮልና
these
ሪስፖንሲቢሊቲ
bodies do have their own clear roles and responsibilities.
ይዘው እንዲሁም ደግሞ ተጠያቂነታቸውንም
There is also
በማረጋገጥ
accountability ensured
ኤፌክቲቭ የሆነ ትራንስፓረንሲ
in order
ስራዎችን
to have
መስራት
effective and transparent
ችለናል።
works on the ground.
ከዛ ውጭ ሬጉላር የሆኑ ሞኒተሪንጎች
Aside from that, regular monitoring, reporting,
ጆይንት ሪቪው ነበረ።
joint reviews also were undertaken.
ያ ከዛ ውጭ
Aside from that,
ፕሮግረሱን በተለይ ናሽናል ሮድማፕ
on the
ተዘጋጅቶ
progress,
ስለነበር
the
ፕሮግረሱን
national
አንድ ላይ
roadmap
የመገምገም
was also
ስራዎች
provided.
ነበሩ።
So we have also been evaluating its progress.
ሌላው ካፓሲቲ ስትሬንግዝን የማድረግ ቴክኒካል ሰፖርት በተለይ
Capacity
ለሪጂናል
strengthening,
ቢሮዎች
especially trainings for regional bureaus,
እንዲሁም ደግሞ ወረዳ
as well as Warada
ለወረዳ ኦፊሶች ነበረ።
offices were provided,
በተለይ ፕሮግራም ዲዛይን እንዴት ማድረግ እንዳለባቸው
especially on how they
ሞኒተሪንግ
should design programs and monitor and do evaluations,
እንዲሁም በተጨማሪ
as
ናሽናል
well
የሆነ
as
ስታንዳርድ ኦፕሬሽናል
the
ፕሮሲጀር
national
ስለነበረ
standard operational procedures were put in place.
ያ ቱልኪቶች ትሬኒንግ ማኑዋልስ
Toolkits, training
ስለነበሩ
manuals were provided.
ዩኒፎርም የሆነ ኢምፕሊሜንቴሽን አክሮስ
This
ሪጅንስ
allowed
እንዲኖር ጠቅሞናል።
for uniform implementation across the regions.
ሌላው ሪሶርስ ሞቢላይዜሽን
The
እና
other one is
ፓርትነርሺፕ
related to
ላይ
resource mobilization and partnerships.
አሊያንሱ
The
ፓርትነርሺፕን
alliance
በተለይ ከዶነሮች ጋር እና ከዩኤን ኤጀንሲዎች ጋር
focused
አጠናክሯል።
on creating that relationship with donors
ዩኤን ኤጀንሲስ
and
ምክንያቱም
UN agencies, because
ያው የመንግስት ሪሶርስ ትንሽ
this is
እንደሆነ
because
ይታወቃል። ስለሆነም
the
እነሱ
state resources are very much limited, and
እነሱ በደንብ ያግዙ ነበር።
their
ፋይናንሻል
supports were
ሰፖርት
enormous,
ነበራቸው።
especially on finance and technical support.
ከዛ ውጪ ጆይንት የሆነ ሪሶርስ ሞቢላይዜሽን ለማድረግ
Aside from that, in
ፕሮፖዛሎችን
order to have a
በጋራ
joint
እናዘጋጅ
resource
ነበረ።
mobilization works, there were proposals
ሌላው
prepared jointly.
ሌላው ኮሚኒኬሽን ቪዚቢሊቲ
The
እና
other one is
አዌርነስ ላይ
related to communication and visibility.
ሬጉላር አፕዴቶች ነበሩ
There were
አማንግ
regular
አሊያንስ
updates,
ሜምበርስ
processes between alliance members,
ላይክ ኒውስ ሌተርስ ኤንድ ፖሊሲ
such as
ብሪፊንግ አንድ ላይ
newsletters and policy briefings were done together
ያ ቪዚቢሊቲን ኤንድ አካውንታቢሊቲን ኢንሃንስ ለማድረግ
to enhance visibility and accountability.
ሌላው ፕሮሞቲንግ
The other
ሎካል
one
ኦነርሺፕን
is
እና
related to promoting local ownership and
ዲሴንትራላይዜሽን
decentralization of the coordination.
ቅድም ያልነው የአሊያንስ
Like
ስትራክቸር
we
ውስጥ
said earlier, the
ከሪጂናል
alliance structure stretched to regional
እና ወረዳ
bodies
ሌቭልም
as
ነበረ።
well as also cascaded to Warada level.
ኤግዛክትሊ ስለሆነም የሃይማኖት አባቶች ደግሞ የዚህ
Therefore,
አሊያንስ
the
ሜምበርስ ስለሆኑ
religious leaders were also members of this alliance.
አት ግራስሩት ሌቭል
And at
ፕሮሞት
grassroots
ለማድረግ
level,
ጠቅሞናል
it
ማለት
was
ነው።
very easy to promote it.
ይሄንን ነው ያለን ኤክስፒሪየንስ።
This is the experience from our side.
Awesome, awesome. Thank you so much, Malet. I think there's a lot to learn from this opportunity there for cross learning between the presentation Malet has given and the CSO network in Kenya. Over to you, Madam CEO. What is the importance of government as a key stakeholder in providing strategic direction in ending FGM in Kenya. Okay, hello. You're muted in case you are sharing. Okay. I think she's still getting ready. Alice, do we move to Hoda and then come back to Madam CEO?
Yes, Jacob, I think we can do that. Thanks.
Brilliant. Okay. So Hodan, over to you. We have a couple of questions. One is, how does MolSAF partner with CSOs, NGOs, and grassroots organizations in Somaliland to accelerate efforts to end FGM? How does MolSAF partner with CSOs, NGOs, grassroots organizations in Somaliland to accelerate efforts to end FGM? Over to you, Hodan.
Thank you, Chaco. WhatsApp continues the collaboration with the partners from civil society organizations, NGOs, and grassroots community, which we named or known as community committee or district committee. And the mechanisms exist for partnership building, including GBV and FGM coordination meetings or working groups, which held monthly by the ministry, organized by the ministry, and bring together the stakeholders of GBV, FGM, and gender issues, as well as an existing of gender cluster meeting, which organized quarterly by the ministry, and bring this together all stakeholders and partners of the ministry. And also we have strategic development workshop.
Proceed as we manage this. Okay. Okay, thank you. It's done. You can proceed. Sorry, Hodan.
Okay, no problem. And as well as we have a strategic development workshops that we invite our partners to participate, and we conduct it yearly in January, and a review meeting held in June for every year. And they take part for our strategic development to share their insights and to share their insights of the policies, strategic issues, and other initiatives that's made by the ministry. I think that's all. Jacob.
Question number 2, what are some of the benefits of collaboration efforts and movement building in Somaliland? What are some of the challenges MolSAF is facing?
The most benefit is that that the efforts and movement building in Somaliland are establishment of grassroots community structures, and which enabled the government to reach communities directly, enhancing awareness and changing public perceptions and attitudes toward FGM. Also, collaboration with religious leaders has helped MolSAF leverage or attract their influences to build trust between advocacy movements and grassroots communities, facilitating social change, as well as close relationship between government and civil society has resulted in strong advocacy and lobbying leading to the approval of the anti-FGM policy, which approved in 2024. And partnership with development partners and donors have strengthened MolSAF's advocacy efforts and support the policy approval process. Financial and technical resources from partners have enabled the ministry effectively implement activities aimed at ending FGM or the practice. As well as, let's get to the challenges. Branding by the development partners and donors can sometimes undermine the government's credibility and ownership, where it shifts the visible recognition and credit away from the government to external actors, as well as it can reduce the sense of ownership and responsibility of the programs from the government. Also, I can mention limited funding because insufficient financial resources can hinder the ability to maintain long-term program and initiatives, and low education levels among grassroots communities slow the process of changing attitudes toward FGM. So because the education plays a crucial role, as we know all, in raising awareness and understanding of the health, human rights, and legal issues related to the practice. When education levels are low, people may have limited access to accurate information and may rely more on traditional beliefs and cultural norms. Fragmentation or different ideas among religious leaders. When religious leaders do not share a common position, it can cause confusion among followers about whether FGM is acceptable or prohibited according to religious teachings. That's all I have. Thank you.
Thank you. Thank you so much. Thank you so much, Jordan. Please, let's appreciate the speakers. Can use the reaction button to either clap for them, send a heart towards them, and for the great work they have done. After quick consultation and quick review at the questions that are here, I'm properly advised that it would be great to move Madam CEO to the last, consider that she's also doing closing remark, and also we'll be able to respond to some of the questions. So we can also save on time, lump this question. Caroline will help us move about these questions, but also just have Madam CEO respond on our question as she does the closing remark. I think that would be really, really helpful under the circumstances. And Alice is helping us connect, help her connect on the internet issue. Over to you, Caroline.
Okay, thank you very much, Jacob. Thank you for that very, very engaging session. Indeed, there's been lots of learning. I have taken home lots and lots of learnings, lots of nuggets. One of the key things that has been standing out matters education. Education, education, education. Every speaker who spoke, there was an element of education and the importance of educating communities and having people improve in terms of their education. I mean, it just stands out. Other aspects that stood out for me also matters data. And then I loved that video on the one that was commemorating the International Day of the Girl. The aspects that I took, language is not neutral. It can either heal or hurt. So the language that we use can either heal or hurt. And survivors ain't broken. Oh, that stood out for me. That really, really stood out for me. And I really, really do appreciate that. So without much ado, we will go into a session of question and answers. I know you've posted some of the questions, you've posted them in the comments, and I just like to look at the ones in the Q&A section. There's Q&A question. There's good afternoon, Ibrahim Wako, human rights defenders, guarantee, Isiolo. What are the cultural issues in Somalia to end FGM? Please elaborate if it is there. So I'll read the questions and then I'll throw it to the panelists and either of you could jump in and just respond because this one is focusing on Somalia, but probably we could also have input from Alice and the team. Then
let's see Somaliland, please, Caroline.
Sorry?
Say Somaliland, not Somalia. Not
Okay.
Somalia.
Oh, Somaliland. Oh, yes. Sorry about that. It's Somaliland.
Yeah, thank you so much.
Yes. Yes. So then the other question that was there is from Alice Karoki. She said she's a community champion in La Parua, Burat Ward, Isiolo County, program manager, IWASGBV, a grantee of TGGLM. My question is, how can I get training for La Parua Maasai FGM survivors in dressmaking and hair and salon and body care as requested by the survivors, so as to be able to start a sustainability project in Leparua, as there is no such project there. Leparua location is 40 to 50 kilometers from Isiolo town and occupied by indigenous Maasai community. Please, I need someone to help and stand with these Maasai FGM survivors. And then there is something else there. There's another good presentation that is just kudos, kudos, kudos. Just appreciating the good work. I'll be glad to connect with the presenter from Somalia. Please share your email. So I'd like us to just respond to the first two questions. Any of the panelists could maybe jump in and just respond to some of those questions. And I'll also check in. Jacob, do we have any in the comments section? I know at some point some people are throwing in some questions.
Is there a specific question here for Somaliland?
Yes.
And this goes to Huda to Hoda.
Huda Mohammed.
Yes, and the question goes, is there a law against FGM and protecting girls in Somaliland? So that's one to you, Hodan. There's a question to Frida of Koval of what are the requirements to join the CSO network? Kindly let new interested person know. Yeah. So just those in the chat. Mostly in
Let
the
me
chat.
answer to Huda Jacob.
Yes.
Thank you so much. And we have the approved policy, anti-FGM policy, which is approved newly in 2024. And the FGM bill is under the FGM bill is drafted, and the consultation workshop continues until now. Thank you.
Over to you, Caroline. Muted, Caroline, you're muted.
Oh, I'm sorry. Oh, I'm so sorry. I've been speaking to myself. So some of the questions that we had in the Q&A, I'm not sure who will jump in and just respond to them. I know I read them out. I could do it again. Did we pick them? There was the issue about the
Carol,
trade.
maybe
Yes,
in
my
the
dear.
interest of time, kindly allow me to jump in to answer maybe two questions, and maybe CEO will be able to wrap some of them up. I wanted to mention that the process of joining the CSO's network has been made very easy. There is a link that you can fill in, and it's already in the chat. Frida has kindly put it there. Please do make sure that you open it and you register if you're interested. The other question from Alice about being able to or getting support to establish a support for girls in terms of giving them some hard skills. That's a very good thought. I think maybe Madam CEO can lead her on how to go about this, but I would also feel like it might be a question that needs a bit of more discussion, and we could probably pick it up from this webinar in the interest of time. Thank you so much.
Thank you, Alice. And indeed, we appreciate the fact that time has really moved. There's so much that we would have wanted to continue on, but again, due to the interest of time and because we want Madam CEO to end the session with her closing remarks as she responds to a question that had been posed to her earlier, Madam CEO Bernadette, kindly jump in and give us your closing remarks. Thank you very much.
Thank you very much. My network might not be stable because I've started my journey back to Narok. So I don't want to take so much time.
Madam Bernadette, I'm sorry, but the network seems to be erratic. Alice?
Alice, do you want to step in?
Step in.
All right.
And Alice, as you step in, also just mention probably this quick one that before, as we close, we have a couple of global goods. Viola would be dropping the links to guidelines on engaging survivors, which has been created by survivors of FGM.
So,
Okay, so just a couple of links, that one on guideline on engaging survivors and another on the transformation power of language that has been discussed here. So I think with the Viola has just dropped the links, or please interact with this material, you print them out, use them on your campaign as they're designed for that purpose. Thank you. Over to you, Alice.
all right. Thank you, Jacob. And I want to really start by expressing our gratitude as a program for all of you, for your steadfast commitment, wisdom, and passion towards a world free of FGM, and even for attending this webinar today. So throughout the discussions we've had today, it is clear that certain themes have been emerging, and we can take them as our takeout for today. Some of the things that I have picked today across the 3 countries that we have been focusing on is strengthening multi-stakeholder collaboration. And this is clear through the networks formed, led by the youths, that we have had young speaking about that, CSOs and alliances, like we have heard from the case of Ethiopia. Another thing that has clearly come out is that centering the voices of leadership of survivors is very key. And we have heard that from Kamar, who has very strongly demonstrated that. So we must keep on ensuring that whatever we are doing, we center the voices of the survivors. And we must also recognize the youth. We must let them also have the place that they need to take, even as they strategize themselves in the movement to end FGM. We must also support them so that they can take their rightful places. So some of the things that we carry forward will be to scale what works. And I'm sure that each one of us has taken points that tells us what works to end FGM. And we must therefore identify the interventions that have proven to be effective in a specific context, because we have also noted that clearly that the context and the countries have got unique environments. And therefore, we have also taken out that, it's good if we take a point that strengthening accountability and political will is very important. We have heard from the governments from the 3 countries, and without the political will from the government, it's going to be very, very difficult for the CSOs to do their work. The other thing the other thing that is really, really key is scaling, it's rather evidence and knowledge sharing. And I had Madam Roloju speaking about data, and Carol also emphasized that. And today's session has shown how much we can learn from each other and contextualize the knowledge into different contexts. So let's be encouraged to continue with the dialogues beyond this webinar. And finally, I would like to call upon all of us, not only the survivors, to lead the fight, but for us to support them. We know that with their lived experiences and leadership, they light the way, but we must also continue to support them to protect and amplify their voices in every space where decisions are made. And so whatever we are doing, we should always make sure that we are centering the voices of the survivors. I really want to thank every one of you for attending our webinar, and I also really want to wish you a very good evening. Thank you so much.
Thank you, everyone. Have a lovely, lovely evening, and thank you for attending. Bye.